Thanks for tuning in today for our program, The Myth of Study Drugs, the problem of prescription stimulant misuse. I'm Stan Rhodes. You probably have heard about performance-enhancing drugs in sports, but how much do you know about the drugs some people think could enhance academic performance? Well, the myth of so-called study drugs could be dangerous, and we're talking about medications doctors use to treat Attention Deficit Hyperactivity Disorder known as ADHD. The misuse of these prescription stimulants is part of the bigger problem of prescription drug abuse. And add on to that, the notion that pills must be safe because a doctor prescribed them to someone. Well, three people are with me today to talk about this issue, and each brings a different perspective to the discussion. First, Dr. Amelia Aria is a researcher and director of the Center on Young Adult Health and Development at the University of Maryland School of Public Health. She has spent years studying the behaviors of college students. Dr. Mark Fishman is an addiction psychiatrist and is the medical director of Maryland Treatment Centers. He works primarily with young people who are in treatment or recovery. And Steve Preserve is the president and CEO of the partnership at drugfree.org, the nation's largest nonprofit organization dedicated to evidence-based solutions to adolescent substance use disorders. Well, welcome to everyone. Let's start with the basics. Let's go back and define what the problem is. Study drugs, what are we talking about? This is something relatively new. Who wants to start?
It really is, as you said, an outgrowth of the prescription drug abuse problem that young people and parents alike in this case look out at all of those different products out there and say, are some of these able to make my life better? And in the case of the myth that has risen up around study drugs is this belief that somehow if I take these products that are legitimately prescribed for other people, they must somehow give me an edge. And throughout the whole issue of prescription drug abuse, we see that constant thing. FDA approved, doctor prescribed, must be safe. And that's where the mistakes really begin.
So it is a misnomer. Are all ADHD drugs the same, ADHD drugs the same way?
Well, they're not all the same, but they do share similar characteristics, similar profiles, both in their advantages and their side effect disadvantages. When used responsibly under the supervision of medical monitoring for appropriate indications, ADHD, other conditions, they're relatively safe, but they need intensive monitoring because they certainly have side effects. Even when used medically appropriately, the side effects of these medicines are often underappreciated. So those can include mood swings, irritability, depression, anxiety, difficulties with cardiac side effects, insomnia, other kinds of things. But then the biggest problem is when taken not under medical supervision, when casually taken in a way that people don't appreciate the downside, people get into real trouble.
Amelia, what have you found that these drugs are usually prescribed for?
Well, they're prescribed for ADHD, like you said, but I think one of the unfortunate problems with the misuse of these drugs is the possible issue that people who really need them for ADHD won't be prescribed them because there is some negative connotation around them, and we really have to be careful because what we're talking about is the misuse or non-medical use. The therapeutic use of them has real benefits to people with ADHD, as Mark could say, even with the known side effects and risks. The idea is to take it under a doctor's supervision and not to non-medically use the drugs.
And when you have ADHD and you're under a doctor's care, you don't get on a trajectory of necessarily getting involved in a lot of other drugs. Whereas if you're just an average kid and you've chosen this drug for my studying, this drug for my relaxing, alcohol when I want to party, you end up seeing these kids get involved in a trajectory of not just misusing the ADHD products, but abusing other substances as well.
So let's step back. What exactly is ADHD?
Well, ADHD is a condition that we've known about for several decades. It isn't well understood in terms of all its mechanism and all of the different subvarieties of it, but fundamentally, people have this condition onset in childhood. It differentiates them by having special difficulty with focus and attention and distractibility. And we've learned that these stimulant medicines, as well as other non-stimulant medicines, can help improve outcomes. As Amelia was saying, there's lots of good reason to prescribe it appropriately for the right people with the right monitoring. But lots of consumers out there might say, oh, well, I've had a problem with distractibility, or I've had a problem focusing, so I must therefore have this condition of attentionitis just because I have attention troubles, and so I must have ADHD. And why shouldn't I try a medicine? My cousin takes it, my brother takes it, the kid down the street takes it, or somebody sold it to me, or I noticed that like caffeine or other stimulants, it helps me concentrate temporarily. Why not? It's got this reputation of being a study enhancer, as we're talking about.
So those are reasons that you use as a doctor to prescribe it?
No, I use a medical diagnosis looking at a much broader set of criteria, looking at the trajectory of a whole person's life, not just their immediate complaint that, oh, it's hard for me to sit still in school. For example, are you bored? Aren't there other reasons why I might have attention troubles? Mm-hmm. And so it's important to use a much broader set of criteria and a much deeper set of criteria, not just the casual complaint of, oh, my grades aren't good enough.
Who are we seeing? Who is in this category of being prescribed medications, Amelia?
In the category of being prescribed or non-medically using?
Well, of being prescribed the ADHD medicine.
Well, I think as Mark pointed out, children usually have their onset of ADHD early on, and so people who are prescribed it typically have been prescribed ADHD medication since childhood, and it's about 5% of the U.S. population has a diagnosis of ADHD.
5%?
Cuts across socioeconomic strata, boys, girls, higher prevalence in boys.
Is it difficult to diagnose?
It's not difficult to diagnose when you follow the approach that Mark did, where you look at the whole child and you understand all the parameters there. But frequently what you'll see is a parent will bring a child in and say, my kid's grades have slipped, or my kid is fidgety, or I've heard that.
So a parent automatically thinks, wait a minute, I've got to do something to
And it
stimulate.
becomes very challenging for a lot of physicians then to push back against the patient. It's like the person who comes in and demands the antibiotics, even though the doctor knows they shouldn't have them. It kind of ends up in that very similar scenario. When we looked at the data, about 25% of kids believe that these could be used as a study aid, but the same study done among parents showed that about 33% of parents believe the same thing. So you've got this belief out in society that these drugs, while they are effective for ADHD, come with an additional set of benefits that maybe I want my kid to experience, and that is exactly the wrong way to look at medicine in any way, shape, or form.
So is it difficult for a doctor to say no?
It's very hard for doctors to say no. We get judged by our ability to please clients, to please patients in terms of customer satisfaction. There's the economic incentive of will they shop elsewhere if we turn them away. But our responsibility as physicians is to do things that are good for people, not just things that people will like. The example of antibiotics, the example of the dangers of prescription pain medicines. People come and have legitimate pain. That doesn't mean that opioid analgesics, which have a whole other set of side effects, including addiction and other difficulties, are the right way to go. Training a generation of doctors to be able to be a little bit more parentalistic about setting limits and framing the patient-doctor encounter in a healthful way as opposed to a consumeristic way is a difficult but very, very important thing for us.
I think it's important to train both physicians and parents to recognize that even though you may be having these symptoms that may look like ADHD, when you dig further down, the student could be having attention problems because he's using other things, because he's not getting enough sleep, because he's in the wrong class, the college level. So I think that Mark's approach to be very comprehensive in the assessment is important for physicians, but also it's important for parents to ask the right questions, because if they're just taking the problem at face value, my child has attention problems and therefore he needs ADHD medications, they're missing the point. They've got to look at the bigger picture.
So describe for me, who are we talking about? What would this child look like who has ADHD? Boy, girl?
Boys more common, girls as well. But I think I'd like to come back and stress a point that Amelia was making. Among the other causes of problems with attention are the use of substances and the loss of focus on academic achievement. And so doctors may not be as good as they ought to be about asking the question, What else are you using? Are you drinking? Are you smoking marijuana? Are you taking other substances? Are you staying up late and having attention problems because you're not getting enough sleep? Are you focused elsewhere? And the same kids that may be prone or vulnerable to looking for a quick fix through a so-called study drug are likely to be, with overlap, some of the same kids that have that other source of attention problems, that is, using other drugs. And I think we don't appreciate or look enough for that as an alternative source of the problem that needs to be addressed.
So who are these kids that are misusing these drugs?
Well, from a misuse standpoint, they run the gamut. You know, there are some who believe it's the high performers. They want to get into the best school, but the data doesn't always show that. It very well may be the average kid who has been going along at a trajectory in school and does begin to drink or ends up with a new set of friends, and the grades begin to slip.
So what age are we talking about?
We're talking about high school and college, really, is the
So
point where
14,
this behavior
15
occurs.
All the way up to 2021.
The
Exactly.
only group that appears to show an increase in the use of non-medical prescription drugs is 12th graders, seniors in high school. So that's the blip on the screen that we're concerned about. It appears to be stable or at least decreasing in the population among other ages, but among 12th graders, it appears to still be persistent.
And remember, you don't get ADHD when you're 17.
Exactly. Yeah.
But then does it increase as the child gets older, goes into college?
Well, we know
Or are you
that
seeing
the
the spike
rates-
right at
the rates or the prevalence is higher among college students than they are in high school. It increases with age and then it sort of tapers off. But in college, there are greater task demands. And I think a lot of students take more credits than they probably should be.
Especially in the beginning.
Exactly.
In the
That
beginning,
first year
and they
experience,
overload themselves, and it's a new environment. So one of the strategies that we advocate is to really rethink the idea of taking the maximum amount of credits that first semester, especially when you're in an unfamiliar environment. And
Away from home and everything else.
try to experience small successes, manage your time, get enough sleep, do the right things.
Is there a specific social economic group that is more prevalent or prone to having ADHD?
Not more specifically or prone to having the diagnosis, no.
But
I mean,
abusing it.
But from an abuse standpoint, it kind of runs into some degree, and again, you may have a little bit deeper data. It's on that college path, it's on that career path where academic performance at the high school and college level is vitally important to the future plans.
And that person may be more likely to have higher educated parents.
Yeah.
But it isn't
So it's all
typically-
those pressures that are weighing in there that would either drive the parent to guide the kid toward it, or very frequently the kid to choose on their own. I know somebody who's using these products. I'm going to try them, see if I get better outcomes in my perception. And frequently now we know the kid believes they help them, but it doesn't manifest in their grades. They don't get better grades. They may study more, but not study as well. They may feel more focused, but in fact they're more distracted. So it becomes this almost circular process of, I take the products because I think I'm doing better, but I'm not getting better outcomes, therefore I take the product.
So it brings us back to the question, how are these drugs being misused?
They're really, in some forms, they're being used, again, under the myth of the study drug, the idea that I have a big test or a big paper coming up, these will help me perform.
But how are
They're
the kids
also-
getting these pills?
Oh, how are they sourcing them? There is supply enough out there in society, in a high school, in a college, to be able to source the pills that they
So
need.
they're not prescribed.
Well,
You have
basically, a person with ADHD, a student who comes to high school or college with those pills will divert those medications, and that's the most common source.
And so we understand what divert is. They are
They're
selling.
giving them away for
Giving
free
whatever.
or for low cost to a friend.
Well, mostly sharing,
Right.
thinking they're helping,
Yeah.
when in fact they're hurting.
Exactly. If you have a month's prescription, you can easily let a few go in a kid's mind. I can give some to my friends, help them out. They have a big test. That's how a lot of this happens.
How many kids are we talking about? Of 100% who are using these drugs, how many are diverting?
Well, anywhere from probably 20 to 60% of a group of people with an ADHD diagnosis might divert, and not continuously or regularly, but we don't really have too much data, but that's a fairly high proportion. So that's something that physicians want to monitor.
That's one of the really important points is when you prescribe for a young person the ADHD drugs, the physician has a responsibility to help the child and the parent as well understand these issues. You can't divert these. It isn't safe for you to give these to your friends. You don't know what the impact of this drug can be on your friend's heart rate or other conditions they may have. I've prescribed them for you because I understand you and I understand the situation. But now we've entrusted you with this product and you need to protect and safeguard it, not divert it. It's not okay. And that conversation, we feel, doesn't happen nearly frequently enough.
It needs to happen at the beginning, and it needs to happen in an ongoing way for ongoing monitoring.
Yeah.
Well, we can continue talking about that, and we will. And as we have learned over the years, young people decide to do drugs for various reasons, and sometimes for no reason at all. Sometimes they want to escape or just to be accepted. Well, you're about to meet one woman who wanted to have it all, a young woman, and it changed her family's life forever.
She was trying to be a good student, is what she was doing. She was trying to focus and maintain being in a school district that's academically aggressive, being in a family that you know, everybody's pretty bright, just trying to keep up and not feeling maybe a sense of having the ability to do that completely.
Started with school-aid pills with Adderall, Ritalin. I believe I started because I wanted to maintain my grades. My first semester in 9th grade, I got straight A's. And it was fun for me. I enjoyed doing it. And as I continued to move through high school, there was a whole different culture that was in high school. There was partying on the weekends started, and meeting all new people, going from a school of 300 kids in middle school to 800 kids in high school. Your social life just increases vastly. And I wanted to be part of that and enjoy my high school years, but I also wanted to make sure I maintained my grades. I wanted to do the best that I could do in everything that I was doing. And the only way I knew how to do it without exhausting myself and being able to maintain the speed that I was doing it at was to take pills. I got them all through friends from all the way through high school. They're pretty much just floating the halls. If you talked to the right people, knew the people to get them from, it was not hard at all.
We had no idea that any of that was going on, absolutely none. A lot of it we thought was a normal teenage reaction of isolation, depression. When I say depression, I mean, it's not the bubbly self, just sort of kind of stuff, and sleeping late and that kind of stuff. So we didn't really think it was out of the ordinary.
They would see my report cards. My grades were good for them. You know, I would do my shenanigans in high school, have, my friends over, go to parties on the weekends, but because of my grades, they weren't concerned about it. They thought it was just normal high school behavior. So there was no red flags that were raised for them, and if there were, my grades would calm their nerves about it. I was really looking for some Ritalin for my finals, and I couldn't find any, so I called this one girl who I thought would absolutely have a connection. I called her, she told me she did, but that they were different looking pills and they cost a little bit more. So I was like, I'll give it a shot, not a problem. It ended up being methadone. After the methadone, I got more into downers because I liked them a lot better, and because it made me feel like I was my normal self. Because I could, it would kind of slow me down enough to be able to sit down and focus and not be wandering in my mind thinking about different things. I started to get more into pills, more into opiates of different kind, and the next step after that, you're going to pay $80 for 2 pills of Oxycontin, or you can go down the street and pay $10 and that'll last you 2 days for some heroin, and then that quickly rolls out of control into, okay, $10, $20, $30, $40, $50 a day. I was up past that pretty fast. I would go in her room and see her doing lines of Adderall and Ritalin with her books in front of her. I was so gone at that time, I would kind of just chuckle to myself, oh, that's like a younger me right there, and so I wouldn't stop her. I wouldn't tell her that it was wrong. I'm like, oh, well, she's just trying to have her fun and do good in school because, she has a dream for herself too.
The daughter who passed away a half hour before she died, I actually said to her in the house, I said, I'm really starting to worry about you. You're starting to hang around with the wrong kids. And her answer, these were her last words, don't worry about me, Dad. I know what that crap does to people. And I believed her. And she looked normal. Everything was fine. And she went into her room and we were going to leave in half an hour to go do something. And when I went up to to get her, she was gone.
It was an overdose, a drug overdose.